Hello, everyone. Good morning. I'm glad to see all of you here. Uh, it's this is going to be a very informative session. Uh, Welcome to this free webinar, all of you. This used to be a webinar that I usually conducted before the beginning of our courses. And this used to be directed only to those who had joined our courses. Eventually, we thought that it's best to give out this information to everyone possible, and it is going to help all of you. I would encourage all of you to keep your cameras switched on. That ways, I will feel that I'm talking to real people rather than just iPhones and some numbers, random numbers. And please try to keep your name so that whenever you ask a question, I know from where that question is coming. And I'd like this session to be quite interactive. You can keep writing down in the chat box. I'll keep having a look at that as well. But when it comes to the questions, I would encourage all of you to reserve your questions till the end of the session so that I can, because there will be quite a lot of things that I am going to discuss. And as the presentation goes forward, you will eventually, most of your questions will get answered. So I would encourage you reserve your questions until then. And yes, okay. Yeah, good morning. Good morning. Yes, thank you. Okay. So I will, before we begin, I would like to just launch this poll. I'd like to know why you all are here. What is the main reason that has brought you all here? So please feel free to answer this. Okay, so yeah. Okay, then I'll end the poll now. There are a few who are still answering. Okay, I will be answering those questions as well. Some of you have already joined the AFK course. Some of you are planning to give AFK and ADAT. I will be answering those questions. Which one should you address first? And yes, so quite a few of you are here because you know a bit about it and would like to know more. So the last session, such a free webinar that I had conducted was in July. And there have been lots of changes that have come up after that. And that is the main reason I thought we'll have an earlier webinar. I was planning one in January, but it's best to have it earlier because there have been so many changes that have come up after my July webinar. And I hope this webinar ends up being really useful to all of you and you gain a lot out of it. And yeah, so first of all, I would like to inform you that we have got a lot of good news last year. From the last year's cycle, we have had 4 confirmed acceptances in the University of Toronto. And unfortunately, there was one person who was on wait list who couldn't get through. There's one person who was on wait list for the McGill interviews as well, but couldn't get through. So we had very high scorers, right, from 670, 660, 640s. So we had very good scores that we saw in the last year. And we are hoping that our students fare even better this time. As we move further, I'll explain you what these scores mean, what does 670 mean, what exactly that score is. We'll be explaining everything that you need to know about ADAT with this. So initially, ADAT was an exam which was conducted by the ADA only for the graduate programs. residency programs in the US, especially to get into endo, perio, ortho, pediatric dentistry. But now, I'm not sure if you all know it, all the universities in Canada, all of them, require ADAT if you want to get into their advanced placement or advanced standing programs. All the universities that have those advanced placement programs require ADAT as a qualifying exam. The last time when I conducted this webinar was in July, and that time there were 5 universities. After that, 2 more universities added, and all 7 universities who are currently offering the advanced dental standing programs for the internationally trained dentists, they all require ADAT as an exam now. So University of British Columbia and Laval University of Quebec, they are still not a part of it, and they don't have the advanced standing program at all yet. So just to briefly tell you how the pathways for internationally trained dentists work, there are kind of 2, I would say kind of 3 pathways. I'll explain about the third pathway as well. So there are 2 major established pathways which are there. So one is through the AFK, ACJ, and the NDECC exams. So for both the pathways, you eventually need to give your virtual OSCE. But before you give your virtual OSCE, you can either give the qualifying exams of the AFK, ACJ, and the NDECC, or get into an accredited dental school. So the accredited dental schools would mean any dental school which is in Canada, Australia, New Zealand, US, and even Ireland for that matter. So all those programs, the dental schools which have those programs fall under the accredited dental schools. And you need to give a virtual OSCE after that. And then you get a license to practice along with a degree if at all you have got into a university. And if at all it's a licensure, you get a certificate to practice your dentistry all over Canada. So let's briefly touch on the first pathway, which has been quite popular, a pathway for several years, but the trend is changing now. Yeah. So as you know, the passing rates are quite low. I'll just discuss it with the facts that we have from the NDEB websites as well. So in the 2003, we can see that around 1,800 students appeared, and eventually those who successfully completed the equivalency process in 2023 were only 131 students. So the highest that we have seen is in 2020. That was the last time when I would say before COVID. So that was the highest number of students who had cleared their equivalency process in 1 year. And roughly in the fiscal year, so this is the same report which is there in the NDB websites as well, a total of 2,200 students appeared in 2022 and 2023 as a fiscal year. I'm not sure what time period they exactly looked into. From 2023 to 2022 to 2023. So from which month are they calculating that? I'm not aware of that. So this is the AFK pass score, which is about 52%, which has been around that for quite some time. And eventually all these candidates, out of these many candidates, 321 students or candidates eventually got their license to practice. They got their certification out of these 2,000. So that's a very small number. Whereas if at all you compare it with the graduates of the Canadian DDS program and the graduates of the Canadian degree completion, you can see this number, which is quite huge. So it is around 560 candidates. So if at all you are part of this, and which you can be, because there are about 97 to 100 seats all over Canada. So that brings up a significant number here. compared to just the 131 or around 321 who clear in about 2 years. So it's a very small number for people, and that is why it is quite a bottleneck. The AFK, I'm sure quite a lot of you might have given it. So we have about 49% to 50% of passing rate, followed by ACJ, which has a pretty high percentage of passing. Uh, and I'd be glad to say that it's probably JADE who has brought this percentage up. But yeah, so when we look into the clinical skills, the percentage drops quite significantly, which is about 34.4. And with the situational judgment, it's a little higher percentage. But eventually, when you cumulatively see both of these, the percentage is quite less. So the percentage of students who clear both these exams together is quite less. So, and that is why there's quite a bottleneck here, quite a lot of candidates who want to get their certifications, but unfortunately they are not able to. So I was talking about the third pathway, which is a very, very newly introduced pathway. It has not been, I would say, it has not been completely established as of today, but there has been a proposal of getting a gap program. And yeah, I will answer all those questions. What makes it different from AFK? Okay, I'll briefly touch on that. ADAT and AFK are slightly different for the way that you really need to score in ADAT, because scores is something that is going to get you judged with ADAT, whereas with AFK, scores don't matter. It's just a pass and fail now. So yeah, I was talking about the GAP program. The GAP program is called as the ITD, or the Internationally Trained Dentist Gap Assessment and the Gap Training Program. So there has been a huge funding from the center, which has come up for letting people go through such a gap program. But the guidelines of how this is going to, sorry. Is everybody able to hear me? Please give me a thumbs up, because, okay, perfect. Okay, so unfortunately, it might be your speaker which is not working. I'm not muted, thankfully. Yeah. So, yeah. So there are about 3 to 4 universities who are going to participate in this GAP program, which will be having certain guidelines. So it will be a shorter program. You can get your license probably quicker. But again, more details are yet to come. They have not yet given out guidelines or requirements of how this is going to come up. For example, Level University does not have the advanced placement program yet, but still, I found this from the University of Toronto websites. And it is also on the Canada.ca website, which has been clearly determined that there will be 3 provinces, Alberta, Ontario, and Quebec, who will be participating in a pilot project wherein few students will be enrolled for this gap training. And after 2 years, once they have a very determined pathway, once they know how things are going, they would come up with a more definitive pathway. So until then, until they come up and clear guidelines have been set, we have 2 established pathways, as I said. And let's move to the second pathway, which is about getting into an accredited dental school, for which you require your ADAT. So what score do you require for ADAT? How many students appear for ADAT? We are going to answer all of that. So first of all, ADAT has been taken since quite a long time, and 2021 was the time when McGill introduced ADAT as a requirement for their advanced placement programs, followed by 2022, University of Toronto fell in line as well. And eventually, there were other universities who declared in 2023, and now in 2024, all the universities who are offering advanced placement programs require ADAT. It is a big requirement for them. They need ADAT, and that's it. You don't require any other exam if you want to get into a university. So earlier, as you can see, there were roughly around close to 250 students who are appearing for ADAT, and that is primarily because they might be appearing for the programs to get into the US, as I told you. Eventually, McGill introduced ADAT as a requirement for their advanced placement program. We saw a little bit of a rise in people appearing. When University of Toronto introduced, there was a significant rise of people who appeared. So the number of candidates is this. Number of ADAT administrations, what it means is there are some students who give exams maybe twice or thrice during the first year. So because of that, the number of administrations increase, whereas the number of candidates is. So if you can see this number, so it's about 1,000. So if we roughly consider, it's about 850 to 800 students at least who are giving exams or the ADAT exam for getting into the university, which is quite a huge number when we compare it with the AFK. And now that all universities require this, we might see more and more candidates shifting to the advanced dental admission test program or the exam. So there has been a very sharp rise in the number of candidates giving the exam. So that is how you know that you are probably competing with around 800 to 900 students every year. And this exam is conducted from the 1st of March until the 31st of August every year. We'll get into that. So what is ADAT? How does the exam work? What all things are required for you to know? So ADAT has basically three components, as most of you would know, as some of you know little about ADAT and would like to know more. So I'm glad there are very few, or rather none, who had selected the fourth option. So ADAT is basically like a tripod. It contains the final score is determined by three components, which is the biomedical sciences, which makes up to 80 questions, about 80. So it makes it's quite a huge percentage. Again, with clinical sciences, there are 80 questions, and with evidence-based dentistry and data research interpretation, or in short, I would call it biostatistics for the future. So these completely make up the entire ADAT score. So all these three components, and they are all three different tests that you give in a small time period. So I'll tell you how the exams are scheduled. And that is why initially when we started the course, it was only two of us, me and my wife, Dr. Sunita, who were running the course. And then we thought of expanding it further with one more person on board, Dr. Priyanka, and she has been a very value addition to the course. So now we have three of us who are handling the entire ADAT course. So each one is dedicated to its own section. I handle the biomedical sciences, Dr. Priyanka. She handles the clinical sciences, and Dr. Sunita, she handles the biostatistics part. Okay, so is this number for Canadians only? Okay, so that is what, I'll just go back to the previous slide to clarify that. So this number includes those who have appeared in US and Canada both. So if at all we roughly assume the number would be around 800 to 900 roughly, we can just assume that it is not given out officially anywhere. And we don't know for what all purposes people give ADAT apart from out of these 1,000 people appearing, for what reason they have given. So we can just assume, as per the historic number that we had, we can just assume that it might be around 800 to 900. So this is the entire number with people giving exams for the US as well. Yeah, so 200 questions making up 80, 80, and 40. And all three have the same weightage. I'll tell you why it has the same weightage in spite of this being 40, this being 80, and how does it become a same weightage as we discuss the scoring. So yeah. So I'll briefly touch on how our course runs. So we roughly have around 6 months of duration of our course cycle. The first course runs from July until February, and it ends before the cycle starts, so that students have an adequate time and they can appear as soon as the ADAT cycle begins, which is on the 1st of March. Then the second cycle, which is going to start very soon from the 2nd of December. So this cycle usually will be run from December until June. And this is especially we end in June, especially because University of Toronto is the first university that accepts applications and closes their applications on the 2nd of July. We'll be discussing all the universities very soon. Which universities require ADAT, how many seats are there, everything about that. So, and the entire course is online. So wherever you are on the planet, you can attend the course. That is the best part of our ADAT courses. So we are 3 ADAT cleared instructors. We all 3 have cleared ADAT with wonderful results. And so we have a very first-hand experience of ADAT ourselves. We have received interview invites from all Canadian universities while we applied. And so we are all 3 thoroughly, ready to deliver for the ADAT exams. And there are 67 theory pre-recorded sessions which will be given out to you. And most of them are released every 3 days. And there are 9 section-wise tests. Section-wise, I would mean there are 3 for biomedical, 3 for clinical, and 3 for biostatistics. And there are 3 full mocks, which is exactly how the ADAT is going to run. So it is the same time schedule. It has the same break amounts that the actual ADAT exam has. And those are 3 big mocks that are going to be. So all these 12 tests and exams that we are going to conduct are going to be extremely useful for all of you, wherein we are going to share more than 1,200 questions with all of you, and something that is very, very closely is representing the ADAT exams. And that is why we have got wonderful results even in the last cycle. So we always hear you. We take up all the suggestions from our past students. We make those changes as required. And that is why we came up with such full courses, which has become much more comprehensive. There are lectures which have more than 110 hours of lecture time. And we have given breaks for you in the schedule so that you can prepare. So these are all the lectures and how they are going to be conducted. So there's a break which will be given out to you after all those lectures are released so that you can prepare for the tests. There are reading breaks in between each section. And these were the suggestions which had come up from our past students. And that is what we have always tried to incorporate. There are a few minute things that we always try to incorporate with suggestions from our past students, because their feedback is very, very important. And that is how we can really run the course very efficiently. And we are very grateful for having such wonderful students in the past. So to just brief up everything, we have about 35 biomedical sciences lectures, 29 of clinical, and 3 data research and interpretation lectures, which covers everything that you would require. A total of 67 lectures, including 3 section-wise tests and 3 full mocks. So this is the one which ends on the 1st of June, and 2nd of July is the time when University of Toronto closes its cycle. So, I'll briefly touch on our team. So that is me. I'm Shrey Pandya. I've done my master's in oral and maxillofacial surgery, and I practiced in India for 4.5 years, followed by which I practiced in the UAE, Abu Dhabi, for 4 years before I moved to Canada in 2021 December. And after that, I started giving my exams. I gave my INBD, ADAT, and AFK. I got acceptances from the schools in US, Canada. And right now, I'm pursuing my dentistry at the University of Alberta. And that's my wife, Dr. Sunita. Uh, and her strength really lies in a complete, comprehensive understanding of your applications towards the questions in biostatistics. And she is the one who is going to make you well versed with your biostatistics. She was the one who even taught me biostatistics when I was giving my ADAT. And you might even see her more when you prepare for your university interviews, because she is usually a part of those sessions as well. So we were batchmates back in 2008. We finished PDS, and she did her master's in periodontics and practiced in India for 5 years, followed by practicing in Abu Dhabi for 4 years. She also finished her AFK, ADAT, and the INBD in the 6 months' time that we were both reading together. And she applied to only two Canadian universities. She was accepted in the University of Toronto and uh, for the master's program in the University of Alberta, and that is what she's pursuing at the moment. She's pursuing her residency at the University of Alberta at the moment. And we have Dr. Priyanka. She is the voice behind all your biomedical and clinical lectures. And she is the one who is going to even take your clinical sciences discussion. She's very much here with us, and I'll hand over the mic to her so that she can introduce herself. Yes, Dr. Priyanka.
Hi everyone, it's a pleasure to be here. My name is Priyanka Suri and I graduated as a gold medalist with several distinctions reflecting my commitment to academic excellence, and I'm taking this further to share whatever I've gained so far with you so you can excel in these exams. So I also after graduating in 2014, I moved to US and did a 2-year clinical research and pharmacology program with NIH. And followed by that, I did a post-grad residency in orofacial pain from, again, Herman Osprey School of Dentistry at USC, which is in Los Angeles. And then in 2022, I completed these board exams, AFK, ADAT, all at the same time. And followed by that, I received multiple acceptances and invites from various universities in US and Canada. And finally, I'm here at San Francisco with the University of California. And I really look forward to help you throughout this exam so you can really achieve the scores that you want and get into the university of your dream. And also recently I have been working with the UCSF as their student ambassadors, where I guide the interviewees who are planning to apply for UCSF in particular. And also please feel free to reach out to me if you plan to apply to other US dental schools. So thank you so much.
Thank you, Dr. Priyanka. Yeah. So, yeah, that's us. And so, which all universities require ADAT, and when do the application cycles begin? I'm sure all of you have been waiting for this part of the lecture and the webinar. So, we have all these universities. There are 7 universities in total who have their advanced placement programs. And the McGill University would be the first one this year because they are running a cycle which will be ending on the 1st of March. So their application cycle would tentatively open on the 15th of January until the 5th, until the, sorry. Yeah, until the 1st of March. And they have a French requirement of B2 and an intermediate or B1 with a proof of enrollment. So this would be the first university of the next year which will be accepting students. And if at all you have this French requirement, you can definitely apply for it along with your ADAT scores. Next would be the University of Toronto. Its application cycle usually begins from the 1st of April until the 2nd of July, and they have about 24 seats. McGill has about 6 to 8 seats usually, and last year they accepted 7 candidates. The year before, there were about 8 candidates who were accepted. University of Toronto interviews roughly around 65 students, close to 65, sometimes 63, 64. So it depends. So it is roughly around 65 students, and they have about roughly 24 seats. And this number also keeps varying. Sometimes it can be 21, 22, sometimes 23, depending on the availability of their seats. But on the website, it says it's 24 seats. Then we have the University of Alberta. It has 20 seats. Its application cycle starts from the 1st of July until the 1st of November. And University of Toronto is where there are students. There were at least 9 students who interviewed with the University of Toronto this cycle, out of which we have 4 confirmed acceptances. I hope there are more, but I don't know of them yet. Hopefully, if there are, I would let you all know soon. So the other universities are University of Saskatchewan, who starts its application cycle from the 15th of December until the 1st of February, and they take up to 10 candidates, out of which 1 is reserved for Saskatchewan candidates. Then the Manitoba Track A. So Manitoba, University of Manitoba, U of M, has 2 pathways. There's a Track A and a Track B. The Track A requires your ADAT, and it opens in November 2024 would be when their cycle of application opens, and they accept until the 1st of April. And they have not given out how many seats are there roughly, but as far as I've known from some sources, there are roughly about 8 seats. And then is the Western University, the latest addition to the ADAT group. So it has it requires it gives out 20 seats. So it takes about 20 applicants. It requires you to fulfill its PLA program, and it is also a program that runs for 3 years. Dalhousie, again, it accepts students up to 6 students, and the deadline for the application is usually the 15th of January, and it is also a 3 years university cycle. So the shortest one is University of Manitoba and Saskatchewan, with both having 2 years of the program. And so there are some programs. So one of them is the University of Manitoba, Track B, that requires you to give your AFK, your ACJ, your NDCC, or your ACS. And the deadline for the application is the 1st of August. So you should have given all of these to be eligible for their Track B. And that is the only program which requires the regular licensing route. Rest all the other universities require only and only ADAT. Okay, so if we give ADAT on March 1, will we become eligible for the U of M for the coming cycle? It would be best to ask the University of Manitoba, because on the website there are quite a few statements which are confusing. So the best thing to ask would be at the University of Manitoba. So application deadline and start date. So I've given out most of the deadlines, and the start dates I've not given out for the ones which are not mentioned on the university website. So all of those who have mentioned the start dates, I've mentioned it here. Most of them have only the deadline which has been given out, which I have given out here. Okay. Yeah. So what should you do to register for your ADAT exam? And I'll hand over the mic to Dr. Priyanka, and she'll continue from here, and we'll interact further.
Thank you, Dr. Shray. So firstly, as Dr. Shray has conveyed, that ADAT was an exam which was basically designed by ADA for American schools for general residencies, some programs which are specialty programs, for example, endodontics, perio, ortho. But again, in Canada, it's relatively new, and it basically started when AFK stopped releasing their scores and they just became pass and fail. That's when the ADAT came into role, because it does give you a score. So that's how Canadian universities decided to decide the merit based on the ADAT scores, and of course, several other factors, including interviews. So firstly, to register for ADAT, you have to create Dent PIN at ADA website. And this Dent PIN is the same even if you take other American exams, for example, INBDE or the other exams that they take. So after registering for Dent PIN, the next thing you have to send them is your ECE evaluation. ECE evaluation is the one which converts your university credentials back home to the GPA or credentials which are equivalent to US dental education. And since ADA is an American association, you have to opt for US evaluation report and not the Canadian one. So that's something you have to bear in mind and consider before applying. And after that, after you receive your ECE scores, it usually takes 2 weeks, 2 to 3 weeks, depending on your home university, like once they receive your transcripts from back home. So after you get your ECE report, you have to select where to send it. And the commission is the Joint Commission on National Dental Examinations, which is JCNDE. And your scores or your report would be sent to them. And once it's confirmed by them, only then you would be sent an email that you are eligible to take the exams, for example, ADAT or any other American exams. And the next thing is which type of report you have to take. So it's a course by course report, because it would give a briefing about all the courses you took when you enrolled in your school, like back home. So it would have all your subjects mentioned with your GPA and credits and grade equivalents mentioned for each of your subjects that you undertook during graduation. So the report requirement is course by course evaluation. And then talking about ADAT administration, the window is from March 1 to August 1. That's the cycle that opens for ADAT every year. And then the administration schedule is, firstly, basically you have a basic tutorial about how to use the test items and how to navigate through the testing screen. Followed by that tutorial, you have biomedical sciences, which is 80 questions and 95 minutes. Followed by that, there is a break, which is optional, but I personally highly recommend to take the break to stretch out a little or have water. And then followed by that, you have clinical sciences, which is again 80 items. And then it has a 10-minute break, which is again optional, but highly recommended. And then the last part is the data research interpretation and evidence-based dentistry, which has 40 items and 45 minutes. So that's in total what the ADAT exam is, and roughly it takes 4 hours and 30 minutes for the entire exam. Then talking about the fee, so the fee includes all those administrative charges, and then there is another fee for the non-accredited dental school graduates. So these fee you can find on their website, and you can also get a score report fee after the scores are reported, if you have to send to the universities after seeing your ADAT scores, basically. So there are 2 ways. Either you can pick as many universities as you want before taking the ADAT when you register, and your scores would be sent to all those universities for free. But again, you are risking the way that you do not know your scores yet, because you did not take the exam yet. So if you decide to see your scores and then send your report, then you have to pay $50 per report. And again, like even if you retake the exam and send the scores, the universities might be able to access your previous scores as well. But again, they can also see your new scores. So it's totally up to you if you decide to send your scores before for free or after, which is $50 per report. And then there is an audit fee if you need to audit your scores, but generally I've never seen anyone's scores changing due to audit. So it's again a personal opinion to decide for audit, but it really doesn't work because everything is electronic and they have all their like database with the correct answers. And then talking about rescheduling. If you need to reschedule, you can reschedule before the exam, 24 hours before, and you can pick a new date. And talking about retesting, that's another thing which I get a lot of questions about. So if you need to retest, it has to be done after 45 days of your previous attempt. And every cycle, your attempt is limited to 2. You cannot take ADAT exam more than twice per year or per cycle, which is from March to August. And if you have taken ADAT previously 2 times or more than that, then from the subsequent cycles, you can only take one attempt per calendar year or per cycle, basically. And also, you need to submit the evidence. They have multiple evidences like proof of requisite of ADAT from the university where you are applying to, or a proof that your score wasn't enough or the university did not accept you based on that. So those are a few proofs that you can use towards taking the ADAT more than twice, like if you have already taken it twice. So that's something which you have to consider if you are in that cohort. And next is the subjects or what all is included. So your first exam or first section of the ADAT would be the biomedical sciences, which has 80 questions. And that would basically include everything that you studied back home, basically in first year of your dentistry, which is gross anatomy, biochemistry, physiology, microbiology, pathology, and dental anatomy and occlusion. And then you have the clinical sciences, which is again 80 questions, and they also include case scenario based questions where you would be given a patient box, which has the patient demographics, then patient's chief complaint, history of present illness, and some clinical findings which they find relevant for you to test on. And the clinical sciences, again, is basically everything that you studied during dental school in clinical sciences. Followed by that, the important component is data and research, which is important because you might not have seen that aspect of biostatistics or evidence-based dentistry back home, as it's very different than what you have studied back then. So Dr. Sunita is really good at it, and she would really help you dissecting all these questions so you can excel in this subject, because I find that most of the students struggle with this component of ADAT. And then it's important to know the tooth numbering system. So in Canada, we are using FDI numbering system, whereas in US, you have to use universal numbering system, which is basically from 1 through 18, 1 through 18 for 1 through 16 for maxilla, and then 17 to 32 for mandible. And same way, you have A through T for the pediatric dentition. So you need to know the universal numbering system because, for example, if they write number 18, so that's not 1-8, that's tooth number 18. So that's something different, and you have to be focused about that. Or alternatively, you can also write down on the extra sheet that you get, just write down all the tooth numbers so you're not confused about it. And then there is perio charting. They might give you, so in the question, you would have various tabs where you can see the clinical pictures, where you can see the perio chart of the patient or the radiograph or FMX of the patient, which is full mouth series. So for example, if you see the perio charting, then you can anticipate that you're going to get some question related to perio diagnosis or treatment planning, and that's how a perio chart looks like. And then you would have a patient box with the patient demographics, chief complaint, history, background, and current findings. Then talking about the ADAT scoring. So ADAT score is scaled score, means you are not getting your raw score or just the number of questions that you got, right? Different questions are having different weightage. For example, if a question is relatively easier, it might be weighted a little down, versus if a question is harder, it might be weighted a little up. And also, if there is a question which, like, there are some questions which are just for research purpose and they might not be scored at all. So if you find some unusual question, I would say never spend more than 1 minute on any such questions, because that question might not even be graded. So you have these scale scores based on the same thing, and the Overall ADAT score is basically an average of your biomedical, clinical, and the research scores. And these scores are again scored separately on the same rubric. So even if there are 40 questions in the research exam, you still have the score, which is graded equivalent with the biomedical and clinical sciences. So that's how your scores work. And I'm sure Dr. Shrey would be able to explain it better.
Yeah. So the scoring system goes from 200 until 800. So if you leave the whole paper blank, you still get a 200, which is kind of 1 percentile, which means that is the least score that you can get. This is the overall ADAT score. This is for the, oops, I'm sorry. My screen moved. Okay. Yeah, so this is for the overall ADAT score. So the highest scorer last year for the 2024 cycle was 730. And and the overall, I'm sorry. In biomedical sciences, we see that there was somebody who had scored 800 out of 800. And our students, I know the highest scorer of was 770, followed by 750 as well. So there were some wonderful scores that we saw. We had high scorers like 670, 660, even 640. So they are all 99 to 98 percentile. So the higher you score, the better it gets. Usually, University of Toronto this year, as to what I came to know, they ended at 560. So some with a score of 560 got an interview call, whereas some with the same score couldn't get because of the GPAs. So usually I would consider University of Toronto as a baseline to judge how you are scoring. So anything above 600 would be a desirable score. And I can see quite some of you have asked that question already. uh, and to continue that, so this is just a bell curve kind of a graph which describes how many students. So there's one student with with a score of 730, one with 720. So there were only three students, if you can see, who were above the score of 680. And uh, so I can say that the person who was with ADAT who scored a 670 was amongst the first top 10 out of all the 1,131 administrations of ADAT that happened. So that is a very good thing. So we would even wish that all of you end up being like that with our course. And lastly, so just in case if you need to contact us, please feel free to shoot out an email to any one of us. We'll be more than happy to answer any of your queries. And we'll take up questions now from all of you. So please, you can dial your questions to either Dr. Priyanka or me in the chat box. Feel free to ask whatever you feel like. About ADAT though. Is there any negative marking? There's no negative marking with ADAT, and that is a good thing. But again, as Dr. Priyanka told you, there's a scaled scoring system which is there. My GPA according to ECA is 3.4 best score. Will that be enough? Okay, so the GPA requirements have been given up on each university's website. So you can just match it up with that. Usually they keep it as a baseline of 3. So you can just see that if you are in the range which they have given out, you're free to apply, and it would be good that you apply. Okay. What would be your suggestion for booking the exam date if we take December to June cycle with JADE? Okay. So this is also one question which I'm frequently asked. So I'll take this booking exam along with the ones who have asked me about AFK and ADAT. So first of all, to answer that, those of you who are giving AFK and ADAT, so if you are planning to give your AFK in February and taking up the ADAT, You could do that if at all you have enough time to manage between your studies. But if at all, I see a lot of candidates who usually are working two jobs sometimes and they don't find enough time to even read for one exam. In that case, I would advise you give your ADAT first. You still have time to give your AFK in August. It's about close to 6 months that you would be losing out on the licensing pathway. But if at all you plan to get into a university, get done with your ADAT first and then move on to AFK. And both the preparations, even if you are preparing for AFK, even if you are preparing for ADAT, both of these are going to help you for the other exam. So AFK preparations does help for your clinical sciences and to some extent partly for the biomedical sciences also, and vice versa. So if at all you are planning to book an exam date, I would recommend that you book an exam date from now itself so that you have a deadline for yourself that, okay, so this is the time when I'm going to give my exam. This is how I'm going to plan my reading schedule. And this is how you already have the schedule. The schedule for the course is given out on the JADE website. You can go through that and just plan your exam, book it from now itself so that you are not fumbling with dates later on closer to the time when you are really prepared. Just in case if you feel that you're not so prepared on the day that you are giving your exam, you can always reschedule it. So, but I would recommend that you book your dates now itself. With so many people applying, it sometimes gets difficult to pick a date that you really want. So, okay, is there any supplemental add-on without joining the full ADAT course? Okay, so if you have already joined the AFK course, no, we do not provide any bridge courses or a bridging course between the AFK and the ADAT because we feel that both of them are individually different exams. They partly help, but that is why we do not have any bridge courses. So there is no supplemental add-on that we can offer you while you are with your AFK course right now. And the ADAT course is completely individualized compared to the AFK. Okay. Dr. Priyanka, if you have any questions, you can address them, and then I'll go back to the questions that are there in my chat box.
Sure. So to add to this, like some people are actually asking like between the overlap of ADAT and AFK. So again, you have to bear in mind that the NDEB is altogether a separate organization that is conducting your AFK and these exams, whereas the ADAT is by ADA, which is again completely different. Even I have seen controversies between the answers to the questions which are based on the articles in CDA versus the articles in ADA. So we have structured this course, which is based on the ADA articles and their guidelines, whereas you may find some discrepancies between the Canadian and American guidelines. So I would say that it's better to to stick with the guidelines and the organization with which we are taking the exam. And I have another question related to IELTS and TOEFL, like which one to prefer or which is better. So again, it's very subjective because some people, I would strongly say actually, if you're applying to US and Canadian both the schools, then it's better to take TOEFL because that way you'll be able to apply to both the schools because there are a lot of schools in US that do not recognize IELTS. And if you're just applying to Canadian schools, both are good. But personally, I find IELTS pattern to be a little simpler. And secondly, you would have more testing centers for IELTS as compared to TOEFL in Canada because like that's what I personally felt when I applied. Like I couldn't find a center in my city. So yeah, again, it's very subjective, but that's how I would recommend it.
Yeah.
And also there was another question, how can we access the recording of this session? So the recording of the session would be there. It's recorded. So
It
I'm
will be
not
there on the
sure.
portal for
Okay.
those of the students who are registered for our program, for our course.
Okay, yeah.
Unfortunately, we cannot give it out to everyone out there. Only those who are registered later on will receive the recording. Yeah. Okay, so I have registered for ADAT and selected many colleges, even if they are not offering the advanced pro. Is that okay? Yes, that is completely okay. Is there a bridging course? I already answered that. No, there is no bridging course. If I do my specialty from US, a 12-month program, can I practice in Canada? That is something that you will have to research into. That is not, that is beyond the scope of this webinar. We would like to stick to ADAT for now. And one you think is more difficult? Okay, so AFK or ADAT. So this is something which I just mentioned. I would consider both of the exams equally difficult or easy compared to in their own individual ways. ADAT is more challenging because you need to score higher. So it is not just a pass that you need with ADAT. You need it. So I would consider it more challenging rather than difficult. Difficult wouldn't be the right word, I would say, for it. Uh, it all depends on how well you're prepared for each of the exams. Some might find it easy, some might find it difficult. Even for AFK, I've seen many who find AFK easy. Some find it really very difficult. So it's a very individualized thing. Bookings open only 60 days before. No, bookings for your ADAT, it's already open. You can book it right away. Okay. If how long does it take for DENPIN and degree verification? Not much. It is very quick. US ADA is really quick with all of that. Uh, it doesn't take more than 2 weeks, right, Dr. Priyanka? You would, for me, it
Yeah.
took hardly a week. Yeah.
Yeah, for
Yeah.
me too. I guess not more than a couple of weeks. I've never heard.
Yes, yes. If you do the course and only finish mocks in June, write ADAT in June. Okay, so for the U of T, so the question is whether you get the results before the deadline in July for the U of T. The thing is that U of T would require you to appear for the ADAT before the 2nd of July. So even if the course gets over, you still have ample time, about more than a month for you yourselves to appear. Even if you are giving it on the 1st of July, U of T has accepted applications in the past, and I'm sure they would still continue to do that. And I have had students who have appeared just a day before and have still got an interview invite from U of T. So that is not an issue at all. You just have to appear for ADAT before the deadline. The results can come in later. You'll have to separately email them or send out the results later on. But and you should be in communication with the U of T while you are giving your exams. So you tell them that I'm giving it on so and so date. I'll be sending out the results later. That would be the best thing to do, I would say. Yeah, can I? If I schedule ADAT for this year, can I reschedule for next year or must no? I'm not sure that can be done. That would be again a question for the ADA. But as far as I am aware, that cannot be done. You cannot reschedule it for the next year because the next year's because once they close one cycle, only then they open up for the next cycle. So I'm not sure if you can do that. What do you think, Dr. Priyanka?
Yeah, I'm of the same opinion. You have
Yeah.
to take it within the same cycle. Since you registered for that cycle, it's just the date you can reschedule within the cycle.
Yeah, exactly. Any more questions you want to take up? I have quite a few lined up.
Yeah, no, I don't have so far.
Okay. Uh, if we give the okay, so this is answered. Okay. Are the pre-recorded sessions self-paced? I didn't understand. So, no, as in you can adjust the speed of the recording, you mean? You can adjust that. You can put it at 2x, 4x, whatever you are comfortable, if that was the thing that you were asking. Okay. It's with Jade only. Okay, so lots of you asking me. Okay. Uh, okay, so 2nd July is the end date for U of T's applications. They don't complete their interviews. They take their interviews usually in October, but the application submission date is the 2nd of July. So whenever you apply to a university, they evaluate your applications and then send out interview invites to you. Uh, has to give INBD and ADAT. INBD and ADAT would be quite similar, I would say, with clinical sciences. So you can just appear, and INBD is simpler, I would say, compared to ADAT because you don't have to get a higher score. So if at all you're giving your ADAT, you can immediately give your INBD, I would suggest. Right, Dr. Priyanka?
Yeah, I also have a question related to like what should be the sequence of ANBD
Yeah,
and ADAT. So I would
yeah.
say if you just want to have the taste of the exam, specifically the American exam, ANBD is relatively simpler. So you might take that first so you have an idea about how everything works, and then followed by that you can keep studying and also take your ADAT. And yeah, that's what I would recommend. But again, it's optional because it also is based on where you get the spot, what dates you are able to block. And because the INBD is prometric centers, whereas the ADAT is Pearson VUE, so the centers are different. And then
Mm.
I also have questions regarding references for ADAT prep. So they do have a reference list on their website which you can access, and you can see what all textbooks or references are considered for the ADAT testing items. And there's a question, does INBD also require a general report for ECE? So it's course by course evaluation for like all these programs. But
Mm.
yeah, so I had a question like if someone has general report before, and would that be appropriate? So I would say like personally, as far as I know, it should be course by course for the universities as well as for the ADAT or INBD exams. Still, you can reach out to the testing administration to double check.
Yeah. And can we just take mocks for ADAT with JADE? You can take the test series, which would include all the 12 tests. We don't offer only the last three mocks alone because I feel that it doesn't make any sense. Just like that. So because our course is designed in a way we have all questions which are resembling ADAT right from the first test until the last one. So that ways you can take the test series. Yes, but we don't have it just for the last three mocks. Do you have anyone who has 500 plus? Okay, do you have anyone who has 500 plus in the first ADAT attempt and has scored over 600 the second, third time? Okay, so I've had some who have scored less than 500 and have gone quite on the higher side around 590, just a little bit short of 600. But I do not have anyone that I know of who had a 500 plus and directly scored a 600. But you could be the first one to do that.
I actually personally know someone. I think her score was actually less than 500, 490s or something.
Oh,
And then she actually got 600 in the next.
wow. Yeah, yeah. So it all depends
It's
on
very
how.
much possible, yeah.
Yes, yes, it's very much possible. It's not that you can never get it. Uh, got a low score, which was in. Okay, if I already have an ADAT score, got a low score, which was sent to the university, will it affect my chance for the interview? Uh, Usually, I think they would look into the last score, but University of Toronto and some other universities also have a section where they ask you to put in the other scores as well. So if they ask you to put in, that might be under consideration as well. But that would be a thing that you would ask that particular university rather than me. I wouldn't be. I hope I was in the admission committee for these to answer it better, but I wouldn't be the right person. None of nobody can answer that question apart from the ones who are actually in the admission committee, I would say.
If I have to add regarding American school, like I actually like the schools actually see it as a positive thing if you're trying to
Yeah.
improve your scores, be it your English proficiency or the ADAT scores. So I personally do not think it would be a wrong thing. Like they wouldn't see your low score only, so they would definitely consider your high scores.
Okay. Uh, so there are quite a lot of questions, and I will have to um, only those which are very much directed towards ADAT, I'll address them. Uh, how does source funding work, and within the scope of? No, unfortunately, that would be beyond the scope of this webinar. About the funding and all, that would be for some other day. Is ADAT a requirement? Again, for MSc programs, you need to check the respective websites whether ADAT is a requirement or not. Repeated question, are there in ADAT? Okay. So repeated questions are there in ADAT? Again, so it is very different. The way ADAT works is quite different compared to INBD. I would say INBD has a lot of repeat questions. ADAT does have, but they mold their question in each paper set. So I wouldn't say that it's completely exactly repeated, but yes, partly it does get repeated, and that is where um, we can help you out with. So they do mold their questions quite a lot, and they change their question format quite a lot, but that doesn't mean that it's not repeated. Are all JADE coaching recorded sessions? Okay, no, not all our test sessions or the discussions are not recorded. They're only for the ones who are attending it, but we do share out the discussion slides later on for those who are not able to attend. But we do not record the discussion sessions. Only the lectures are recorded, and they will always stay with you until you give out the exam. So for that current cycle, so don't expect us to have the same portal. So there is a portal that JADE has where all the recordings, articles, notes, discussion slides, everything is shared there. And that portal access is usually available until the same cycle. So for example, if you register now, you will have the access to the portal until August. And if there are sometimes the admin comes out with certain offers and things like that, if at all you fall under that, there can be an extension of the portal as well. But again, that will be a question which the admin looks into. We purely look into the admin aspect. I mean the academic aspect. We don't look into the admin aspect. How can we approach our doubts? Okay, you can still reach out to us through emails. On these emails, Dr. Priyanka, if there are any questions which are pending for you, you can take them up.
Yeah, sure. So again, there was a question if ADAT is mandatory for American schools. Again, it's not really mandatory if you're applying for DDS programs, but I would personally say I've seen many people actually proving their profile. For example, some of you might have GPAs in 3s or 3.5s. So always taking an exam doesn't hurt, which can show your academic caliber. So I would say some people, they just take ADAT to show their competitiveness or where they stand in among the pool of the candidates who are applying. So it doesn't hurt if you have taken ADAT and you are applying to the schools which do not really want ADAT, they would still, like, they also mention if they consider or not, but again, it's a positive thing to add to your CV. Then there is a question, is JADE's material sufficient or do I have to go through other books as well? So we have really been working meticulously on making the material more concise. Why? Because there are a lot of materials and resources available for you, and it's basically impossible for anyone to go through everything. So we are just catering our material, which is very much dedicated and direct to the aspects of the testing items that are there in the ADAT. So I would say the material is good enough, and I would personally recommend to go over the lectures and the materials twice if possible, so you get the hold of the core of the subjects and how they are being tested, because it's not a pure memorization, it's actually application of the concepts, because the intent of this exam has always been towards residency, which means you need to have a basic knowledge and then a knowledge that you can apply towards the clinical side of dentistry. So
Exactly.
yeah, I would say the JADE's material is good for you, like good enough. And then I have a couple of questions regarding evaluations again. So some of you might have WES. I'm sure some schools, they do accept WES, but not all of them. I personally had to go get ECE and WES, both of them based on the schools where you are applying to. Also, again, the institution ADA or the universities are the best people to reach out to for all your queries related to the evaluation purpose. And is there a way to self-prep for ADAT after joining AFK course? Again, of course, any of these courses are basically going to help you for the exams. Our role is just to guide you because you have a vast pool of resources, everyone saying one thing or the other to prepare. So our job is just to guide you so you can study in a focused manner, because time is something which I would personally say is the most crucial factor. For example, if you are self studying and it's taking you more time compared to a focused approach and getting everything done within that time frame, that's where it makes the difference. Of course, it's possible to self prep and take the exam and do good, like get good scores, versus studying with the, like, nothing guarantees. Even if you study uh, with us or with anywhere else or by your own, it actually, what matters is what your basic knowledge is. Because personally, I feel some people actually struggle with the biomedical science and research as well. Biomedical science is why, because we studied it back then in the first year of dental school, and again, going back to that anatomical perspectives, those nerves and blood vessels where they are exiting, entering, like those things are something I would personally feel that if you are self-prepping might take you a lot of time. So that's my take on it.
Yeah, thank you so much. Yeah. And last few questions. Do we get notes of JADE for ADAT course materials along with the pre-recorded lectures? Yes, we give out hard copy notes. It will be shipped to you along with the pre-recorded sessions. And do we have a class group or something that we can discuss our pre-recorded class contents or any other questions once we join JADE? Yes, we usually encourage you to send out an email to us if at all there is any doubt. But yes, we do have some Facebook groups, which it is up to you whether you want to join or not. And you can join those groups and create your own little discussion group within yourselves and have all the discussions regarding all the contents or other questions that you would like to solve amongst each other. Okay, so how many doctors took the JADE course in 2024? So, 2024, it should be roughly around close to, we had 25 plus 20 plus the before, so should be around 45 to 50. I would say, yeah, roughly around 45 to 50 students. We had roughly around those. I would say 20, 24, 24, and yeah, close to 50, I would say, in 2024. How to access the online portal after registering? Yes, you will get the access through the team. The admin works on that part, and they send out all the relevant things to you. Once you are registered for the course, you don't need to worry. The admin really looks into all of that. I've registered for, okay. So this will be the last question I'll address, and then we should call it a day. So I've registered for ADAT in March. Which universities can I apply to? I know McGill, U of T 25 for winter intake. Anything else? Okay. So as I shared earlier, so University of McGill requires you to appear for the exam before the 10th of March. So if at all you are appearing in March in the first week, you can still apply for McGill. But apart from that, if at all you are appearing in March, there is no other university that opens up until that time, as far as I know. So I'd given out all the deadlines. I hope you all have noted that down, and that can really help you. If there are any further questions, please feel free to shoot out an email to either any three of us. So we would be more than happy to answer all your queries. Okay, then. Okay, I
I
hope
have
you
a
all.
couple of questions to address. I'm sorry to
Oh, is
interrupt.
it? Okay, sure, sure. We can. We'll take a
Okay.
few more questions then. Yeah.
Okay, so one of the questions is regarding interviews, if it's easy or what's the criteria. Again, different schools, they have different set interview styles. For example, McGill has multiple mini interview. You actually have actors in group of 3 or 4 posing as difficult patients, or any ethical dilemma where they are trying to be your friends or neighbors or anything. So that's really a tricky part. So like all the schools, they have really different styles of interviewing. The U of T is a direct interview, but I would still say they put you in ethical dilemma, and then they do have follow-up questions for that, and then again a question regarding GPA score. So it's based on your BDS degree, not just overall score, but actually your every subject score is converted into a grade, the grade which is deemed equivalent to US education. And for example, if you have A's in all of the subjects, then your overall GPA is going to be 4.0. But based on that, like they do have different gradings for each subject, and your overall GPA would be calculated based on that.
Yeah. I'd just like to add to that. Some universities look into the last education as well, and quite a few look into your BDS. So if your last education was your master's, then they might look into that as well. So it depends on universities to universities, and the best thing to ask would be at the university themselves that which GPA they would be looking into. Okay, so all right, then I think we should call it a day. I hope you all benefited out of it. I wish you all the very best for your ADAT preparations. Feel free to reach out, even if you're not joining JADE. We always try to help as many as we can, and if at all you are joining, I would love to see you all during the next discussion cycles that we have. Most welcome, all of you. See you all.